Deep within the human digestive tract, the gallbladder functions as a highly sensitive and precision-timed chemical engine for your body. It is responsible for deploying a perfectly concentrated chemical cocktail, bile, into the intestine at the exact moment dietary fat arrives and needs to be broken down. Millions of people rely on everyday prescriptions to manage serious health conditions. Yet for many, these same drugs can silently alter the baseline rules of the gut, creating an environment ripe for gallstone formation. To protect your digestion while managing a prescription regimen, you have to look at how these medications interact with your internal biology. There are two primary pathways to gallbladder disruption. This diagram shows the first pathway, reduced motility. It's a mechanical failure where the gallbladder stops squeezing properly. We call this biliary stasis. Without regular contractions to empty it, stagnant bile thickens into sludge that can eventually harden into stones. Some of the most common catalysts for this mechanical slowdown are GLP-1 receptor agonists, widely prescribed for diabetes and weight management. These medications work by slowing gastric emptying to keep you feeling full longer. However, that specific mechanism also reduces the digestive signals that normally tell the gallbladder to contract. This effect isn't limited to weight loss drugs. Certain hormone therapies, specifically those containing progesterone, can create a similarly dampening effect on the gallbladder's motor function. The biological trade-off is clear. Whenever we artificially delay the gut's normal rhythm to treat one issue, we risk creating a mechanical stasis problem in the gallbladder. The second pathway is an altered composition. This is a chemical failure, where the exact recipe of the bile itself is ruined by external interventions. This chart illustrates optimal bile, a delicate balance of cholesterol, bile acids, and phospholipids. When that ratio tips, bile becomes lithogenic. This happens if the liver dumps excessive cholesterol, or strips away the bile acids needed to keep it dissolved. Fibrates, which are prescribed to manage cholesterol levels, are a primary example of this stripping effect. They lower blood lipids, but a side effect is that they chemically limit the liver's synthesis of those necessary bile acids. Conversely, estrogen therapies and oral contraceptives trigger the opposite chemical failure. Instead of reducing bile acids, they increase the secretion of raw cholesterol into bile. Large cohort studies show that oral estrogen formulations carry a higher documented risk of this cholesterol dumping. Because oral pills are metabolized directly through the liver, they impact bile composition differently than transdermal patches. Common blood pressure medications like thiazide diuretics are also documented to alter bile composition, though researchers are still mapping the exact metabolic pathways involved. There is even emerging data around gastric acid suppressants like PPIs and H2 blockers. Altering stomach acidity can disrupt the downstream gut-bile axis and influence how bile acids are recycled. Whether a medication starves the bile of its dissolving acids or floods the system with raw cholesterol, altering that chemical recipe creates the perfect environment for stones to build. The takeaway here is not to throw out your prescription medications. These drugs perform vital work for your body. The goal is proactive awareness. If you rely on these medications, you should initiate a conversation with your prescribing physician about your individual gallbladder risk. For those looking to actively support their digestive system's bile availability, independent of their medication use, our sponsor has developed a targeted approach, Gallavance. The Gallavance original formula uses delayed-release capsules packed with bile acids and phospholipids. They're engineered to bypass stomach acid and open in the intestine, where fat emulsification takes place. And for consumers looking for that same targeted digestive support without animal-derived ingredients, Medisyn Labs offers the Gallavance plant-based option. The human body is a highly interconnected ecosystem. By understanding how medical interventions affect your digestion, you can stay ahead of side effects and maintain your systemic biological balance. Note that these statements have not been evaluated by the Food and Drug Administration, and this product is not intended to diagnose, treat, cure, or prevent any disease.